A lot of therapists and students ask us how exactly the YNSA procedures go. So we're going to demonstrate a quick treatment. We have Tuvia here, our patient. Tuvia suffers actually a lot from a lower back pain. We have a lot of lumbar spine issues. He had an accident a few years ago, and since then we have a lot of problematic back pain. So we are going to show you just the procedure itself. Okay? Always we're starting with the area of the hands. We are going to palpate LI4. That's the first observation that we're doing. Left side.
Yeah.
Okay. And then I'm going to the area of the arms. Okay, we have brain points area and basic points area. So, and from here I'm going just to run with the treatment.
Yeah, left
Side.
left side. No.
Okay. So the left side in the elbow is a reflex for the upper brain area. Okay, actually this area is the basal ganglion.
The down one.
Yeah.
Ouch.
Okay. After knitting, I'm just palpating again to see that the reflex
Yeah,
is
smooth.
more smooth and subside. The pain is a bit subsided here.
Yeah.
Okay. I'm going through all the 6 areas. That area also.
Try up.
Here.
No, yeah. No.
That one.
Yeah, this one.
Okay.
This one is relaxed now.
Great. So I'm going to the left side. That's the area actually of the cerebrum itself.
Yeah, here.
Yeah. See, I'm finding a sensitive point and again needle that and go back to the reflex.
Oh, that's good.
That's good. Now,
That's hurting.
I'm going to the basic point area.
No, that is
Searching again all the
no,
6
the first
points.
one.
The first one here.
Yeah, and also on the other hand.
Okay.
Yeah.
So we have another point here that's going to subside the
Yeah,
points
that's hurt.
the reflex of the elbow.
Yeah, that's now smooth.
Great.
Oh.
Okay, we have the second side here, the other side here. So I will needle again.
Yeah, this one.
This area actually, it's point, very useful point for neck problem actually, A point.
Yeah, now it's fine.
Good.
Now,
That
this one.
That one is more sensitive. Now,
this is more nikudati.
okay, it's more focused pain, you can say. Okay, so I'm going to the lumbar area now. That's point that's called point D,
Yeah.
and it's sensitive, right? Nice.
Yeah, now it's nice. Really nice.
Okay, actually here all the sensitive regions here passed, and then I'm checking again LI4 to see if it's also subsided.
Yeah.
Right. Can move a bit
Yeah.
and see it better.
Yeah, much better.
Okay, so generally in this stage I'm going to ask him to lie down. We're going to leave the needles approximately 40 minutes, and we can continue with TCM, body acupuncture, balance method, and so on. And actually, this is the frame of the procedure here. Okay? More about the points and more about how to use them in our next workshop. See you. Thank you.